Imagine walking into a hospital and instead of a human nurse greeting you, it's a robot. One so real and lifelike, you might pause before realizing it's not human. Now think about this. This robot isn't just a prototype. It's treating real patients, making decisions in a clinical setting, and is powered by a brain developed with NVIDIA's AI chips. Yes, I'm not joking. This is happening right now. Meet Grace, the AI-powered nurse robot developed by SingularityNET and Awakening Health and made on the powerful Hanson Robotics platform. Yes, the same people behind Sophia, the humanoid robot that once got Saudi Arabian citizenship. But Grace isn't just about headlines. She's about healthcare, and she's already being used in hospitals in Hong Kong and mainland China. Let's break down how this happened, why it's groundbreaking, and what people are saying about letting a robot nurse take care of your grandma. From Sophia to Grace, a smarter, softer robot for healthcare. Grace was more of a collaboration between Hanson Robotics and SingularityNET. While Sophia was built to be a general-purpose conversationalist and a showpiece for AI-human interaction, Grace is designed specifically for healthcare environments, especially for mental wellness and eldercare. She's equipped with facial recognition, emotion detection, and real-time conversational AI. So this means that she can identify when a patient is sad, anxious, or in pain. She speaks English, Mandarin, and Cantonese. Her silicone face is modeled to be soothing as well as expressive, and her voice and tone are made to calm patients. And here's the best part. She's powered by NVIDIA Jetson, a platform designed to accelerate edge AI. That gives her the ability to process complex data on site without needing to constantly have contact with a cloud server. In a hospital setting, this is a game changer. It means real-time responsiveness, privacy-preserving data processing, and much more smoother interaction. Grace is already in hospitals, and it's just the beginning. In 2025, Grace has transitioned from lab prototype to field-tested professional. She's been deployed in several eldercare homes and hospitals, notably in Hong Kong and some trial units in mainland China. Her main tasks: monitoring vital signs, offering companionship to patients, helping with guided therapy, and supporting nurses in numerous tasks. In one pilot study, Grace was shown to reduce patient anxiety scores during post-operative care, simply through consistent interaction and empathetic dialogue. In dementia care units, her ability to remember previous conversations and maintain emotional continuity with patients has been called comforting. Healthcare workers have reported that she's not here to take jobs, but to take care of the tasks that burn them out. Things like putting in the vital signs, giving routine medication reminders, or talking to a lonely patient for 30 minutes. But it's not as simple as it sounds. The public reacts, comfort or creepy. Let's be real, people have opinions. And when you put a humanoid robot in scrubs and call it a nurse, the internet goes crazy. On Reddit, one user commented, "This is how the robot uprising starts, through eldercare. Brilliant strategy." On X, formerly Twitter, the reactions are mixed. If a robot can take my blood pressure without attitude, I'll take her over the ER nurse who hates her life. Imagine coding, and the last face you see is this weird animatronic staring at you like HAL 9000. NVIDIA chips in a nurse's head? That's scarier than any horror movie. But there are also positive notes, especially from healthcare professionals. We need help in hospitals. Burnout is real. If this robot can handle routine tasks, it's a win. I worked in eldercare for 10 years. Companionship is critical. If Grace can make an old man smile, that's a good day. And yes, the memes are also going viral. Grace has already been dubbed Nurse GPT, Florence Robotics, and Silicon Nightingale. A healthcare revolution or a privacy nightmare? The tech behind Grace is obviously impressive. Her NVIDIA Jetson brain allows her to process voice, facial expressions, and sensor input locally, reducing the causes of data leakage. She uses GPT-like models for conversation and SingularityNET's decentralized AI framework to operate semi-independently. But here's where the major ethical concerns kick in. Who owns the data she collects? What happens if she malfunctions during a procedure? Could she be hacked easily? And here's the worst part. If she makes a clinical error, who's responsible? The hospital, the developers, or the AI? The companies behind Grace say they've put strict boundaries in place. Her medical interactions are supervised, and she's not authorized to administer medication or perform invasive procedures. But who knows what she may be authorized to do in the future? And hey, we've already seen what happens when facial recognition goes wrong. Now imagine that built into a robot that decides whether or not to call for emergency intervention. Imagine begging a robot to call for a doctor, only for it to tell you it's probably just in your head. I mean, that won't be any different as compared to doctors these days. I'm just kidding, don't come at me. Should we be excited or worried? So here's the thing, technology in healthcare isn't new. From MRI machines to robotic surgeries, we've always tried to push for more efficiency, precision, and better patient outcomes. But there's something different about putting a humanoid face on that technology. Grace represents a turning point, not just in how we use AI, but how we feel about it. And if a machine can fake an emotional connection well enough, does it even matter? I have to agree that if a machine can fake the emotional connection better than us, then let it stay. In Eldercare, where loneliness is increasing and resources are stretched thin, Grace may be more than a new design. She could become a companion, a helper, maybe even a friend. But the danger lies in treating her like a perfect solution. We shouldn't use Grace to replace human interaction, only to help it. We shouldn't view her as a cheaper nurse, but as a more specialized tool designed for support. Because as realistic as she is, Grace doesn't have problem-solving skills like us, she has a processor. And no matter how smooth her words or soft her silicone skin, she's not perfect at all. Whether you find Grace fascinating, creepy, or just another step in our inevitable robot-filled future, one thing's clear. The age of AI caregivers is no longer fantasy. I can't help but think of Baymax again. Big Hero 6 is all I could think about when I saw this robot. It's in hospitals, it's talking to patients, it's logging in the vitals. And it's powered by a chip you could buy off the shelf. This is exactly like the movies, guys. And as NVIDIA keeps pushing the envelope and AI models get smarter, more empathetic, and more autonomous, Grace might be the first of many more robots to come. So, what do you think? Let me know in the comments below. If this video made you think twice, hit that like button, subscribe for more AI robot deep dives,